Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
We've all heard someone complain about having a bad gut, and oftentimes we don't realize just how common this is. And I want to talk about in detail what the scope and the statistics of irritable bowel syndrome actually are in this country, and what you can be doing when it comes to your diet, when it comes to different nutrients that can be incredibly supportive and beneficial for maintaining the intestinal mucosa lining to try to avoid having these flare-ups and this constant irritation. I'm Amanda Williams, MD, MPH, and today I want to talk about irritable bowel. We know, according to the American College of Gastroenterology, that this is a very, very common problem within the United States, and it's estimated that upwards of 15% of the adult population suffers from some form of irritable bowel. So what does this actually include when we think about the different types of symptoms with irritable bowel? How is it that one can be technically categorized as having irritable bowel syndrome? And this can include issues with diarrhea. This can include issues with constipation. There can be mixed symptomology where one time you have constipation, the next time you're having diarrhea. But we know that this is really very common, and we know that we can have issues with bloating and distension. We know that there can be recurrent abdominal pain, and this can really have a significant burden to someone's overall health and their sense of well-being. We've all seen the different pharmaceutical commercials that are on TV where people are showing that they're missing out on key parts of their life because of the irritations of irritable bowel syndrome. So we know that this is a problem. We know that so many Americans are contending with this on a regular and consistent basis. So where should we start, and how do we look at this in terms of the massive problem that it truly is? Well, I think first and foremost, you have to look at the diet, and you have to say, how much of a role is the diet playing into this chronic inflammatory problem that's occurring? And we can even take this out even more broad, and we can look at things like Crohn's disease and ulcerative colitis to be included into that scope of irritable bowel diseases. And what we know is that foods are a major trigger to this. And unfortunately, for many people who have been diagnosed with irritable bowel syndrome, whether that's ulcerative colitis, Crohn's, or just IBD with constipation or IBD with diarrhea, is that they're usually not given the full tools to really manage this and to try to allow for some correction. And the reason why is because they never address the foods. Oftentimes it's immediately, let's look at what medications that we can give someone. And that's a really unfortunate thing, because oftentimes what we find is that once we start to put the right nutrients in and we're getting less inflammation within the intestines, we're getting better absorption of nutrients, many of these symptoms begin to go away. And so I always say foods truly do matter, and having that adherence once again to a diet that's high in fiber, naturally, occurring fiber from foods, fruits and vegetables, for example, high antioxidant foods, very, very important. But we also have to recognize that when someone is at a point with their irritable bowel, sometimes they'll find that when they start to incorporate these healthy foods in, this actually becomes incredibly problematic for them as well. So we know that it comes down to the inflammation factor and it also comes to gut dysbiosis. So when we have a bad blend of bacteria that are residing within the intestines, we know that this can also exacerbate all of those symptoms. So what do we talk about when we talk about gut dysbiosis? Well, we know that the human is carrying anywhere from 1 to 4 pounds of bacteria around with them on any given day. And these bacteria are initially intended to keep us healthy. However, we can have too many bad bacteria that start to kind of outweigh your good bacteria. And when this happens, this can certainly bring on excessive inflammatory response, which can worsen a scenario such as irritable bowel. So we know that the bacteria play a role in this, and we know that we need to focus in on taking things such as probiotics. Now, a single strain probiotic, is that going to be enough? And when I say a single strain, if you just take a probiotic that just has one targeted specific strain of bacteria, is that going to be enough? Generally speaking, no. We know that we need to be using a multi-strain because there are hundreds of different bacteria that reside within our intestines. So we want to do a nice job when it comes to matching up the good. And if we take a multi-strain probiotic, such as probiotic HX, we are going to be optimizing that recolonization of those good healthy bacteria, which is one of the first places to start. But then we also have to think about what can we do to ease up that inflammatory response that occurs. Well, we can look no further than looking at resveratrol. This is something that I just really find so incredibly fascinating, that it is so widely known and widely studied in the setting of irritable bowel, but yet never discussed in terms of traditional medicine. I mean, someone can go see a GI specialist and they will probably never tell someone, hey, resveratrol could be beneficial, even though we know for the last 10, 15 years, they have been studying the overall impact of resveratrol when it comes to regulating the inflammatory response. We know from the frontiers in cellular neuroscience that resveratrol helps to improve the brain-gut axis by regulation of the 5-hydroxytryptophan dependent signaling within the intestines. Why is that important? Because for many people, they may find that due to, say, periods of stress or anxiety, this can actually worsen their irritable bowel. So, what is it that the resveratrol is doing? It's helping to support the better regulation of serotonin release within the intestines. So it's really quite unique when we think about resveratrol, because most of the time we think of resveratrol as being this anti-aging supplement that people have touted as being very beneficial for helping to support cellular longevity. And we know that is true. We know it helps with the activation of sirtuin, which is going to help with the end caps of your telomeres. So the protection of those end caps, we know that the more of the sirtuin that we have, the better off we are, sirtuin 1 in particular. But let's look at another randomized placebo-controlled trial. And this one was done back in 2015, where they were looking specifically at the anti-inflammatory effects of resveratrol in patients who had ulcerative colitis. So this was a randomized, double-blind, placebo-controlled trial. And the goal was to say, we know that ulcerative colitis is this really chronic, idiopathic inflammatory disease in which trying to regulate and reduce those pro-inflammatory modulators, these molecules that are driving up all of the inflammation within the intestines. This is the mainstay of what the actual treatment is. So when you see these commercials on TV, that's what they're targeting. They're targeting that inflammation. But the problem with a lot of the prescribed synthetic medications is they can also really have an impact on down-regulating your normal immune system response, which can actually create a situation where we are more open to a potential infection. Now, we know resveratrol is not working that way. We know that resveratrol is working via the targeting of NF-kappa beta. And we know that NF-kappa beta is this master driver for inflammation within the intestines. So we have recognized that resveratrol has this really just profound ability to downregulate NF-kappa beta. At the same time, it also has been shown to have a significant reduction in things like TNF alpha, so tumor necrosis factor alpha, another marker that they look at in ulcerative colitis when it comes to that inflammation. So within this study, what they did is they took a group of patients who had ulcerative colitis and they supplemented them with 500 milligrams of resveratrol every day for 6 weeks. And then they went and they looked at all of these different serum inflammatory markers. They're looking at NF-kappa beta, they're looking at tumor necrosis factor alpha, and they found this really marked improvement. And they said within that 6 weeks of supplementation with resveratrol, we have shown improvement in the quality of life as well as the clinical disease state of colitis. And they said this is done through this inflammation reduction in patients who have ulcerative colitis. So I think that this is one of those areas where, for me, being in the natural world, but also having the strong foundational understanding when it comes to traditional medicine as well, that I just sit there and think, if only we could get more of this information out to people. If people only knew, like, hey, maybe if I were taking this wonderful supplement, resveratrol HX, for example, which is giving you a wonderful amount of trans resveratrol, that's that biologically active component that we want to be utilizing, that's going to help to fend off oxidative stress, helps with that sirtuin 1 activation, helps with the downregulation of NF-kappa beta and TNF alpha, all of these things that could be very, very useful when it comes to how we approach things like inflammatory bowel diseases. And we know foods. We know that the foods matter. We know that those good healthy bacteria, those probiotics matter. But we also have to look at things like glutamine. Glutamine is the most abundant amino acid in the body. And we know that the body makes glutamine for its regular needs. However, when the body is under any type of stress, the body needs more glutamine. And this is really proven when we look at stress in the intestines. So when we have excessive inflammation, that's hence stress that's occurring within the intestines, the glutamine stores begin to get diminished. And this is really a major issue because we understand that glutamine is utilized for so many different vital functions. We know that it's required for rapidly dividing cells. Well, where is one area that we have rapidly dividing cells? Within the intestines. So we do not have adequate glutamine stores to turn to help to support healthy cell turnover. Then we are once again up against a really steep incline. And how do we change that? Well, we start to incorporate glutamine into our routine. And we know from clinical studies that glutamine supplementation can help to support the immune system. We know that it is very beneficial to such a degree that they even use this in really severe burn patients, for example, where they know that glutamine depletion can slow the process of their healing. There was a study that was done over 15 years ago talking about the role of glutamine in gut protection in critical illness. And this was done through the Department of Anesthesiology at the University of Colorado Health Sciences. And they were looking at the role of gut permeability. And we know that this is an issue that comes up in irritable bowel. So they were looking at systemic inflammation, gut permeability, hence leaky gut, and saying, would glutamine play a role as a potential agent to prevent this gut barrier compromise and help to attenuate these better gut inflammatory responses? And after doing their research, this is what they were able to come to the conclusion on, that indeed the glutamine played this extremely protective role. So we know all of these different things. We now know the important role that omega-3 fatty acids come into play when we look at easing inflammation. We know the role that vitamin D plays when it comes to our immune system, when it comes to targeting inflammation, having a proper inflammatory response. We know all of these different things, but we now know so much more about the role of the most abundant amino acid in the body, glutamine, and how that can help to support the intestinal lining. We know the role that resveratrol can play. So the more we have as our toolkit, the more we can help to repair. If we are trying to repair something with no tools, we're not really serving a purpose. So we understand that foods can be part of that tool. We understand what foods can actually drive up inflammation versus the foods that ease inflammation. We understand what amino acids can be beneficial for intestinal health, glutamine. We understand what vitamins are important for intestinal health, vitamin D. We understand what other nutrients such as resveratrol can do to support the intestinal lining. And then, of course, we have to pay attention to the recolonization of those healthy bacteria to create an environment in which the foods that we are taking in, those healthy foods, are properly absorbed so that we can get those nutrients from those. We can get those antioxidants, those vitamins and minerals, and key omega-3 fatty acids. There is so much that goes along with the world of irritable bowel, and being that so many people are dealing with this, it is a process in which your approach to trying to resolve this issue certainly can be achieved, but it has to be done with the right steps. You can't just take a medication and not change the diet. That's just not going to work. We know that we have to make the dietary adjustments. We know that we have to put the good, healthy bacteria back in. We know that we need to target the inflammation and we need to sustain that. And how do we achieve that? Is through some of the things that I had just mentioned: the probiotic, the glutamine, the omega-3 fatty acids, the healthy diet, the resveratrol. So a lot that goes into GI health. That's just one little way to look at it. In the future, I will definitely break down each one of those nutrients based off of how beneficial they are for the intestinal health beyond that of someone who is maybe perhaps dealing with irritable bowel, but that will be on a future episode. But that is all that I have for you for today. I want to thank you so much for tuning in to the Invite Health podcast. Remember, you can find all of our episodes for free wherever you listen to podcasts or by visiting invitehealth.com/podcast. Now, do make sure that you subscribe and you leave us a review. You can follow us on Facebook, Twitter, and Instagram at Invite Health, and we will see you next time for another episode of the Invite Health podcast.